The bad news? COVID-19 may be around for a long time. The good news? Even if it does, new research suggests it could very well end up being just another mild illness, bringing with it inconvenience and discomfort, but rarely hospitalization or death. Why? The theory is rooted in the epidemiology patterns previously followed by 4 other coronaviruses. All have been in circulation for a very long time. In fact, they're endemic, which means that most people get infected and develop immunity during childhood that protects against serious illness as adults. And that trajectory led a team of investigators to model what might ultimately happen in the future if most people were similarly exposed to the new coronavirus during childhood. In the vast majority of cases, the endemic human coronaviruses cause nothing more than a common cold, upper respiratory tract infection, said study author Jennie Lavine. They sometimes lead to lower respiratory tract infections, particularly in very young children and the elderly, Lavine noted. Only in rare cases, among particularly vulnerable populations, do they trigger more serious illness. It seems likely that COVID-19 will end up playing out this way, she said. But exactly when that would happen is anyone's guess. She cautioned, with projections ranging anywhere from 1 to 10 years. And there's always a chance it might not unfold that way at all. We'll continue in a moment, but first, consider subscribing to the channel so you won't miss important health-related videos. Lavine cited a number of factors that can affect future developments. One factor is how quickly the virus spreads in the near future. Another is how quickly the public gets vaccinated in the coming months. And it also remains to be seen how many infections and/or vaccinations will ultimately be needed to trigger strong and durable immunity. Another issue is to what degree natural infections and/or vaccinations are able to block viral transmission altogether, versus how long either are able to block the serious illness that can develop following an infection. Another concern: the virus could mutate in a way that undermines the development of widespread immunity. However, as long as viral evolution happens slowly enough that people are exposed to new variants while they still have some disease-blocking immunity from vaccination and/or exposure to previous variants, we expect the disease to remain mild, Lavine said. But one thing is clear, she said: we can influence the path to endemicity. How? One way is by keeping transmission rates as low as possible until vaccination is widespread, to reduce deaths and prevent overwhelming hospital systems. Another way is by getting vaccinated, especially if you are at higher risk of severe disease. While it is likely that everyone will get infected with this virus at some point even after vaccination, the vaccine will very likely reduce your symptoms, she said.